Dear Daily News Report viewers, after watching this video, you can reach the video we shared yesterday by clicking on the top right button. The main topic of yesterday's video was about American economy and predictions of the situation in the post-crisis. We recommend watching, subscribing and sharing. Thanks in advance. The internal response of the coronavirus is expanding rapidly in the United States of America. At this point, every United States state and territory declared an emergency, and President Trump declared the outbreak to represent the national emergency. Nevertheless, there are concerns that local and state levels of intervention capabilities and resources may become overwhelmed in the coming days, weeks, as spread occurs and serious cases exceed the capacity of healthcare facilities. In the past, the United States Army was sometimes called to provide support during a national emergency. United States Army called for it to play similar role during the coronavirus response. Recently, United States governors, presidential candidates, and others have sought military assistance for domestic coronavirus intervention. President Trump said the Army is working with states and the Department of Defense to provide additional resources and assets. This brief statement answers key questions about potential military involvement of the United States in its domestic response to the coronavirus. For the purpose of this summary, it refers to the military armed forces, in particular to the staff and assets of uniformed military services in the Ministry of Defense and their reserve forces. First, can state call in a National Guard and other parts of United States military? According to the National Response Framework, which directs federal, state, and local interventions to emergencies, local and state governments are expected to be primarily responsible for emergency interventions in their jurisdictions. However, given that intervention capacity at local and state government level has been exceeded, governors have the option to request military support by mobilizing national security units in their state. In fact, almost half of the United States, 44%, have already activated many state guard units for coronavirus responses. The National Guard reports that March 19, more than 27 Sentinel members helped coronavirus response activities in 27 states. Second, who decides when the United States military will be involved in local emergency response beyond the National Guard? Whilst governors can request assistance from the United States Guard beyond the National Guard, it is up to the President or Secretary of Defense to decide whether to provide support. At the federal level, the United States Army can engage in internal intervention in one of two ways. The first is that the federal agency that led to the emergency response can request military support by sending a request for assistance to the Ministry of Defense. HHS had been the leading agency in the response of the United States until March 18. It was announced that it would take the leadership of FEMA. The other is that the President or the Secretary of Defense can choose to provide direct federal military support to the national intervention, including deploying active duty staff and calling National Guard staff to federal service. Third, if the United States Army gets involved in the coronavirus's internal intervention, who controls and manages military assets during these efforts? State governors command state-level National Guard assets and personnel when they mobilize for state-level interventions. For federal intervention, even if the United States military is involved, the intervention leadership remains in civilian agencies. DoD assets are on a support mission in the case of coronavirus. FEMA is a leading federal agency and as an important operational agency with the support of HHS. It will work with military and state leaders as well as military commanders to properly direct resources. If the National Guard units are federated by the President during the intervention, there is a commonly military-civilian command structure implemented. Fourth, what United States military capabilities and assets can support the internal response to the coronavirus? The United States Army has abilities in various areas that can be called in the local coronavirus response. It has important capabilities and assets to support communication, transportation, infrastructure, engineering, construction, and other technical and logistics fields. More importantly, the Army also has experienced scientists and medical professionals, medical supplies, and military medical facilities with deployable mobile field hospitals, permanent health facilities, 2 large hospital ships, each with an estimated capacity of 1,000 beds, USNS Mercy and USNS Comfort. Fifth, are these capabilities appropriate for the native civil coronavirus response? Although the military has important abilities as described above, not all resources are available for civilian use, and they are not likely to all meet civilian coronavirus response needs. Military officials, including both Defense Minister Esper and Joint Personnel Surgeon, were careful not to overestimate the capabilities the United States military could provide in the coronavirus response. The Army can deploy, build temporary field hospitals as well as improve or prepare other facilities for use as temporary hospitals. The Navy also has 2 large hospital ships, each with a capacity of 1,000 beds. Nevertheless, military field hospitals and hospital ships are designed and used primarily for human trauma and war injury care, rather than infectious disease care, and patients often provide short-term care that is quickly discharged to other healthcare facilities. Another point related to the deployment of military medical resources, such as field hospitals, hospital ships, is that staff will be assigned after these units are deployed. Currently, with concerns about the inadequacy of civil healthcare professionals and the constant needs to focus on DoD medical professionals' military needs, it is uncertain where the additional healthcare worker capacity for staff to multiple field hospitals and hospital ships will come from. Sixth, can United States military medical resources used for civil intervention affect the military's ability to meet the needs of its members and dependents? DoD prioritizes the health of its staff and addicts and has tried to minimize the risk of military members from infectious diseases in the past. DoD is concerned with exposure and spread among COVID-19 staff by reporting 37 confirmed cases as March 17. Military officials expressed concerns about diverting military medical resources from their current duties as a primary target for United States military medical resources for protection of force health. Decisions regarding their use for local civil intervention would weigh potential impacts on the military's efforts to address the health of its members and addicts. Likewise, many health workers working in the reserve units of armed forces, including the National Guard, have civil jobs in healthcare. Calling them for substitute removes civilian roles which can adversely affect civilian intervention. So the appropriate role for healthcare professionals called for service needs to be carefully considered.
Most of the idea, comment, information, and criticism containing in these videos have been created by Daily News Report. Before making any important investment decision, use the information contained in these videos as a starting point for conducting your own research. If you make any investment or legal decision, it is advised to consult an expert before making this decision.